research conducted at the University of California, San Francisco concluded that COVID-19 is able to progress much more easily in people who smoke. Dr. Timothy Quinn practices family medicine in Ridgeland. He joins us now live via Skype. Thank you so much, Dr. Quinn.
Hey, thank you for having me.
Well, tell us, how does smoking negatively affect a person's ability to fight COVID-19?
Well, Jade, here's the deal. Right now, we're in the middle of the COVID-19 pandemic, and a lot of people are very stressed. And this is really impacting them in that if they do smoke, they're more likely to smoke because of the stress, which is a major trigger. Now, the research that you spoke of in California, this research is actually going on all over the world in different countries. And interestingly, the same conclusion is being reached pretty much. And that is that if a person smokes, they almost double their chances of having a COVID-19 disease progression state, meaning that if they smoke, they're more likely to get more sick and end up in the ICU, or even they're almost double more likely to end up losing their life. So, I mean, smoking, it really impacts us, and it actually interferes with our immune system, and that's our ability to fight off an infection, such as a lung infection caused by COVID-19.
So is there any good news here for smokers?
I'm so glad you asked that, because there is good news. And the good news is it's never too late to quit. If you visit the CDC website, there's a very encouraging statement, and it reads, individuals who stop smoking, they have healthier lives and they have less smoking-related disease. And basically this is due to the fact that, and it's well documented, when an individual stops smoking, their lungs start to heal automatically because they're not exposed to those very harmful toxins that are derived from smoking. But also the research is very clearly stated that when an individual stops smoking, now the research has shown that individual has improved lung function within 30 days. I mean, that's less than a month. Your lungs are already starting to regenerate and you're getting healthy again. So we really need to really focus on trying to stop smoking if we do, especially during this time.
It's certainly a bad habit to kick for so many people. What would you say is the first step a smoker should take if they are serious about quitting?
Well, you know, it's so funny because I have this conversation with my patients every day. I mean, I always have at least one patient that's a smoker. And I encourage them. I say, we really need to stop. But I revisit what I spoke of earlier, the fact that during this pandemic, a lot of my smokers are smoking more because they're very stressed. I mean, they're worried. And when you talk to them, they're worried about, you know, basically, I don't want to get COVID-19. I don't want to get sick. Hey, I don't want to lose my life. And because of this, it makes it harder. But what I do is I try to educate and talk about the benefits to stop smoking. Of course, we talk about you're going to save some money because smoking is really an expensive habit. But more importantly, especially with the concern that they have, as I said earlier, I inform them that if they can stop smoking, then they can better their chances. So if they do get COVID-19, they have maybe just half of the chance of getting very sick, not able to fight it off because their immune system is not as impacted, but also they have less of a chance of losing their life. And once they start to understand the benefits to stop the smoking, then they understand that the thing that they're worried about most is the risk is much less, and now we can go ahead and get that start date.
Okay, then. Thank you, Dr. Quinn. All right, we appreciate you coming on as always, and we're back after this break.